getting wired up here. All right, thank you so much. I want to say it is an honor and a pleasure to be here with you today. I cannot wait to share information about our college and about what our plans are, and I look forward also to input from you all that we want to receive. So I just want to talk just a little bit about ETSU, the College of Nursing. I'm not sure how much you know about it, but we are the largest College of Nursing in the state. So we currently have over 1,400 nursing students. So a lot of people don't realize that. We have 3 campuses, with the main campus in Johnson City, and then we have a campus in Sevierville, and then the one here in Kingsport that's at Allendale. And that's the one that I'll kind of target most of our talk about today. But I do want you to know the big picture, the over 1,400 nursing students that we have. Right about 1,100 of those are pre-licensure students. Those are all people that are working towards earning their Bachelor of Science in Nursing degree. So we have multiple programs, everything from an LPN, licensed practical nurse, to a BSN, that Bachelor of Science in Nursing. We have an associate degree to BSN. We have traditional programs, BSN programs, accelerated programs. We have multiple masters. We have a couple different doctorates, doctorate of nursing practice, that's a DNP. We also have PhD in nursing. So, and then we have some bridge programs between all those. So really it's trying to get our nurses at the highest level that we can, because they are serving you all, right? We don't want to be in that hospital bed, right? We don't want to be at the recipient, but every single one of us will be at some point in time. So very large college. One of the, when I started going around, I got here in August, mid-August. It is like drinking through a fire hose when you have 85 faculty members, and we have about 180 employees. Another aspect that I do need to mention is we actually have 7 nurse-led clinics that fall under the direction of the College of Nursing. These are clinics that are all throughout the state, or mainly on the eastern side, but they serve the underserved. They serve our homeless population. They serve those that have a harder time having access to care. So our nurse practitioners work in those clinics, and then we have undergraduate and graduate students that also go through those clinics as well. So that's a big part of our operation within the college as well. So when I first got here and I was visiting all the sites, and I came to Allendale for the first time, I looked around and I thought, you know what, we can do a little bit. We need to do better. We need to do better with our education was what it needed to be, but our space and the resources that we had for our students needed to be better. So you don't get what you don't ask for, right? So pretty much, I think it was September, October, something like that, I submitted a request. I went around, got input from faculty, and I said, what do you want? What would you, if you could dream big and money was no objects, what do you want? And I got feedback from everyone, and I really targeted in, we needed to hone in on simulation. We needed to not only have dedicated space for the College of Nursing, but we needed to increase our simulation, healthcare simulation that we have within the curriculum. And we'll go through and I'll give you kind of my rationale. But I would like to know in the room, when I say the word simulation, does anybody know kind of where I'm going with this? A few nods. So yes, so simulation, we've seen simulation in aviation, right? Other disciplines have simulation. Probably aviation, the military, they were really at the forefront of that. When you go back in history, you really look back, about 1911 was kind of one of the first where we tried to simulate things. So simulation is mimicking the real environment, right? So we want as we train and educate the future nurses, our workforce, we want to make sure that they are not practicing on you all, right? You don't want them practicing on you all. We want to back up their education where they're practicing in a safe environment where they actually can make mistakes. And it's okay to make mistakes. And that's where we want them to make mistakes so that we can go in and work with them and provide that direction and guidance and correcting them so that when they are with you all, they are comfortable and competent and safe. So we really didn't, at our Allendale campus, we just really didn't have this. So I submitted a proposal, and at this point, it is we are waiting for approval from THAC. We've got approval from ETSU. We're waiting on approval from THAC. The site has given us about 13,000 square feet. So we are we have to do renovations and things like that. And a big part of it will be simulation. Let's go to the next slide, because I want to talk, while yes, we do research, we do service, we do scholarship, we do all this, but I will say our two main charges are to develop the nursing workforce, right? Develop that nursing workforce and then provide continuing education for the nurses that want to go back and further advance their degrees, right? To practice at a higher level. Those two are our main charges. Now, challenges that we have, limited clinical space, right? And we've always had limited clinical space. COVID definitely threw a curveball for all the health disciplines, right? We needed to keep our students safe. We needed to keep patients safe, things like that. So the clinical environment was definitely restricted during COVID. We still have sites where we are still being restricted, whereas you used to take 10 nursing students with one faculty member into the clinical setting. And some sites are still restricting us to only 4 students with one faculty member. So we're still restricted. Another area where we're restricted is in faculty. You can see if I used to have a ratio of 10 to 1, and now I only have 4 to 1, do you see how I greatly need faculty? I don't think, I'm sure, I know you all have heard the news, the nursing shortage, everything. We are really in a dire shortage. We were in a shortage prior to the pandemic. The pandemic has made it much worse. Our nurses are exhausted. All of our healthcare providers are. So we're really under pressure to meet the needs of this nursing workforce, but at the same time, we cannot decrease that rigor, right? You don't want us to do that. You want us to ensure when we graduate those nurses that they are safe and they are competent and they are at the same level that all the previous nurses. Just because we need them badly does not mean we cut corners, okay? So in a lot of ways, we feel like we're holding that line right now. There were instances, now I can't speak for the state of Tennessee. During the beginning of COVID, there were states that agreed to let some of the nursing students, it wasn't just nursing, other disciplines as well, go ahead and graduate early and enter the workforce. But we're really trying to hold that line going after that quality. So where simulation can help us is, while simulation has been around since 1911, in nursing, we've had it, but it has drastically changed with technology and innovation. Really, when you start looking about 2003, 2004, 2005, right in there was when we really started seeing the development of human patient simulators and really upping our game using technology. And there's a lot of science behind it now, or I should say it's still in an infancy, but what we do have is we have evidence that it works. There was a landmark study published in 2014, really comparing how we had educated nurses in the past to how we are educating them now with simulation, and they are finding that the ones that were educated substituting 50% of the clinical, what used to be clinical and they use simulation, the results were equal. So there's a lot coming out with that evidence and research that this does work. It really, really does. So let's go ahead and switch to the next slide. I love this quote. It's from Benjamin Franklin. Tell me and I forget, teach me and I may remember, involve me and I learn. So now when I look at that, the modern term would be experiential learning, right? That's sometimes students want that passive learning, but we need those nursing students. We need them engaged. We need them right in there. That's how they will learn the best if they're in there. Isn't so insightful? So long ago. So let's talk. All 4 of these pictures are actually they're all simulated. Those 4 pictures all have mannequins. Those are not real patients. But look how real that looks. And when we create a comprehensive simulation program so that I can absolutely guarantee that every graduate coming out of the nursing program has certain experiences. Did you know if I send nursing students into the hospital right now or out in the community, I cannot guarantee what they will experience and what they won't, right? I don't know when somebody is going to have, a heart attack. I don't know when somebody is going to have a postpartum hemorrhage, right? That happens like this. I can't predict that. So I don't know if the students are going to see that or not. But what I can guarantee when we have a comprehensive simulation program is I can absolutely guarantee that every one of those nursing students will not only have experienced this, but if they struggle in this, which is okay, then we're going to stop, we're going to talk about it, we're going to regroup, and then guess what? We're going to do it again, right? And we're going to do it again until they feel comfortable. So until they feel comfortable to where, let me go ahead and go to the next slide. These are real. And actually, there's not a lot of real pictures of obviously. And I hesitated, and you all are not eating. So I am used to talking and eating talking about body fluids and all that while I'm eating. Afterwards I thought, man, I don't know if they'll be eating when I do this. But this picture on the bottom right is the aftermath of a trauma. And guess what? I can create that in a simulation, in a simulated environment. And it is real. It is real to them. We create sounds, we need to create an environment where a lot of times we'll pipe in extra noise and chaos and things like that because the students have to learn how to do drug calculations when somebody's screaming or crying or there's orders being given across the room. They need all that stimuli, and we give it to them in little doses. It's definitely leveled up to where when they graduate, they're comfortable with this. So while this is real, we can recreate this in simulation. Okay? So at our Allendale campus, and I think going forward I just have pictures of different cases. These are other campuses where you're going to see some of our mannequins. Some of them are lower fidelity mannequins or even task trainer mannequins might just be maybe just an arm or a pelvis or something so that they learn tasks. Our higher fidelity mannequins are more the higher level. Their pupils constrict and dilate. They have lung sounds, they have bowel sounds. We can put fluid in their bladder, we can put blood in their veins, we can put in chest tubes, we can do all sorts of things to the higher fidelity mannequins. They can speak. We can speak for them. As an educator, we can speak for them. There's just many things we can do with these mannequins that we haven't had before. There's a mannequin that gives birth. There are baby mannequins that, I kid you not, if somebody was 6 feet away and was holding them, you would not know that was not a real baby. That's how realistic they look. So at our Allendale campus, we currently enroll 30 students in the fall and 30 students in the spring. That is our cap on those. The caps, again, really are bound by the clinical placement, again, in the hospital. How much space in the hospital can we accommodate students? We can't take, and there's a lot of communication between the academic side and then our clinical partners. How many can they take? And then also there are 13 other nursing schools in the area, right? So that our clinical partners have to make sure that they're also accommodating the other programs as well. So currently we are capped at 30, fall and spring. Now, where simulation comes into play is the fact that research has shown we can substitute up to 50%. If we have quality simulation, if we have the space, the resources, and the knowledge of the faculty, okay? So I'm already working on the faculty to where they have the education that they need for this type of teaching. This is a little different type of teaching. This is very different than standing up in front of a classroom. So we need to make sure, my job is to make sure the faculty can teach this way and have the credentials that they need. And we're already working on that. We're developing our curriculum, our comprehensive simulation curriculum. So now it kind of comes to the space, to the resources that they need to be successful. I think this would be a game changer for this site. If we substitute that if we get our simulation up to 50%, substituting for that clinical environment, we could actually take in more students in the classroom, and they would be doing simulation and then also clinical. It would be less of a burden on the clinical site. All right. Any questions or anything else you can think of that you want me to talk, or we'll kind of go through the slides?
Yeah, I've just kind of been.
Have you? Okay. Yeah. Yes.
Give them an idea of, as we discussed, how quickly you could ramp up in the teams, the number of teams, and what it could mean to the number of students. You mentioned you could increase it, but your
sure.
vision and what it means to the Kingsport area.
Absolutely. And again, it goes back to approval from THAC. So once we had approval from THAC, it's going to take, honestly, the construction. So they gave us 13,000 square feet. We need about $2 million to do the site, and that includes the soft costs. It doesn't include all of, maybe not all the mannequins, but we're looking at least $2 million to get started on that. The timeline I've been given is that we could begin working with an architect this July, pending THAC's approval. It would take probably about 8 months to work with the architect, and then once we had the funding, they could begin construction as early as next spring if we had the funding. With nursing schools, they're different than other disciplines. When you increase up students, you don't just do them a couple at a time. You do it in increments of 10. And the reason you do that is because it goes back to the clinical sites take groups of 10. So really you wouldn't increase 2 or 4 because you're going to have that extra faculty member. So you might as well go up to 10. So we could pending, construction would be approximately about a year is what I'm being told. So that would be spring of 2024 or summer of 2024. Starting in that fall, we could start increasing up in increments of 10 in that fall cohort. So again, it takes students a while to get through. Another thing that we could do if we had this, what I'm wanting to build is a state-of-the-art simulation center. And with this, then I can offload from the main campus, because what we're building here, is actually much, much better than what we even have on the main campus. So our programs, the LPN to BSN and the RN to BSN, which actually are spread across the state, but then occasionally we will bring them in, as well as our nurse practitioner students. They will come in for task training, different skills days. So when we bring them in, rather than bringing them in to the main campus, we would bring them in to Kingsport. Right? Mm-hmm.
Did you say that there are 13 other nursing schools in this area?
13 other nursing schools? Yes, that go, and I say that because we do work mainly with Ballad. Ballad is the main system where our nursing students go, and Ballad hosts 13 other nursing schools other than ETSU. Some of them are small. Mm-hmm. Some of them are very small. Mm-hmm.
So thinking nationwide, how long do you see this nursing shortage persist?
I actually think it may not be what you want to hear. I actually think it's going to get worse before it gets better. I really do. And we've known about this for a while. We have. You look at the average age of a nurse. I think you look at the nurses that have worked through the pandemic, and there's some, you're very loyal, but I think there'll be some that they'll get us through, and then they're going to say, I cannot do this anymore. And what we're seeing is that money is not motivating people anymore. Mm-hmm.
You give an excellent program, and I do appreciate it, and I'm sure the rest of us do, but do you also work with VA?
We do work with the VA, we do have students at the VA, and actually the VA is an excellent preceptor site for us. Mm-hmm. So we do undergraduate students and graduate students there. And actually, I love the VA, and we try to get as many there as we can. So, and they actually, the healthcare facilities, they tell us how many they'll take and what units. We will ask, can we have such and such experience? Or, we'll always ask. But, obviously, we are guests in any of the healthcare facilities, any of the schools. We are guests. So, yeah. Mm-hmm.
I'm a Tennessee Tech grad. A couple of years ago, I had a chance to go through their nursing school, and I understood somehow there might be a collaborative effort between East Tennessee State and Tech. I wondered if you might comment on that. Absolutely.
So there is a collaborative agreement that started right about, I believe it was the fall of 2015, whereas it was actually connected even with the engineering. So ETSU desired to have an engineering program. TTU wanted to have a doctorate of nursing practice program. So our DNP program in nursing was very strong, very, very robust. So working with the state, the agreement was made that we would collaborate on those two areas, with engineering and then with nursing, and have been doing it since, I know the agreement was signed fall of 2015. I don't really remember if it was that next spring when it started. So yes, we do have that. Uh-huh.
Nurses are difficult to retain, I think, as a general rule. What are some of the things that you do to try to retain nurses in your system?
Right. It's a good question about what do we do to retain nurses in the system. So we have recently with Ballad set up the Appalachian Highlands Center for Nursing Advancement. So it was a gift, a $10 million gift to the College of Nursing that we received starting last fall. So that is one of the initiatives of that, is to really look at how we can do it better. What do we need to do to not only increase the pipeline of people coming into nursing, but then how do we keep them within the area, and how do we retain them? So there's, I think, more to come on that. What we are learning is money is not necessarily the motivator with this generation. We're looking at a lot of resiliency training. they're doing all sorts of different things. I think the pandemic was just, no one had ever experienced anything like this. Mm-hmm.
I guess my question is more on the recruiting side. I have a daughter who graduated from Northeast State Surgical Tech program.
Mm-hmm.
They have a split program, cardiac and regular. But then she just needed to go to work. She ended up getting her RN in Richmond through the hospital,
Mm-hmm.
working. But then we have a seat. I never knew that she was recruited to go on to the nursing program at that time at ETSU or anywhere else. But then we have at our newest high school, Westridge, we have a very robust CNA
Mm-hmm.
program with the mannequins that are there. Are you recruiting those graduates?
We are actually going all the way to 7th grade. We are starting in the 7th grade. And that is one of the initiatives with the center that is being brought up is, I think maybe when all of us were in high school, it was almost like late high school before we were really deciding, or even into college. Now it is so much earlier that kids are just so much more impressionable about what profession they want to go into. So, but we are working on that. I do want to, because I want to save time for Ann to speak. So this is Ann Godfrey. She is the Director of Development within the College of Nursing. So she does the finance piece, right? I get to do the fun part and tell you all the cool things that we would do with extra funds. Oh, can we forward it to the virtual reality? Can we do that one more?
Tell me which one.
It's one of the last ones. I want to show you something that is on the horizon, or it's virtual and augmented reality. Keep going. It's towards the end.
Oh, towards the end.
Yeah, it's at the very end. Is it not there?
That's the last one.
Oh, okay. All right. Well, so virtual and augmented reality is something that it's new, right? It goes back to technology, innovation. We are now, we do not have any at the College of Nursing, but it is something that I am looking to purchase for our students. Like the Oculus Rifts, putting on the goggles. And here's an example. When we teach nursing students how to put on sterile gloves, right? How do we teach them in the past? How did we do that? Well, we gave them a pair of gloves and we had to give them like 50 pairs of gloves. Well, now, or 100, until they actually got it right. Now we're finding that a lot of things that are actually just psychomotor tasks, we can put on virtual goggles and they can learn that muscle memory, in their head. So much, and then once they've got it, you can hand them one pair of gloves, and they've done it so many times virtually in their head. You give them one pair of gloves and they've got it. So that is the future. And actually, I shouldn't say the future because it's starting now. We just don't yet have that in our curriculum. So that is something that you can also use virtual situations to put nursing students in that would not be safe to put them in. Some like mental health scenarios, some violent situations that actually as nurses, they might be in at some point in their life, but virtually we can put them in that and teach them how to handle it. So let me turn things over to Ann.
Change topics for a minute. I'm so loud. Do you want me to use it?
Oh,
Okay.
do you need this?
Yes. Thank you. Thank you. Thank you all. I'll change topics for a quick second and then we'll go back. I wanted to share with you all, this image isn't super clear. It's kind of a copy, a screen grab from my work computer. I wanted to share with you the page on our ETSU club site for our Circle K International That's a Kiwanis club at the college level, and we're excited to partner with you all in that way. I bet we have a bunch of ETSU alums in the room. I'm sure it's fascinating to hear how education is changing, especially if any of you came along in one of our academic health sciences colleges. So as Dr. Horsley mentioned, this is really exciting. We are passionate about bringing state-of-the-art healthcare education to Kingsport. We have an exciting vision for it, and we know that you all are a generous, creative group, and I know you're passionate about making a difference. I know you share that with us. Something we also know is you all have a great deal of competition for your time, your talents, and your resources. Right? We'll never have enough to support everything that we want to. However, we feel this is a project worth prioritizing for our community, for all the folks who live in this region, and selfishly for all of us, right? Because we need these nurses. I'm not getting any younger. So what I am here to say to you all is, I hope you'll partner with us. Fundraising is a process that takes time. It really kind of moves at the speed of trust. So I'd like to spend time getting to know Kingsport better than I do and picking brains of some of you amazing, well-accomplished, and frankly well-connected folks in this room. I'd love to reach out to you, and if any of you all would be interested in getting together for coffee, for lunch, I can come by your office, your house, wherever you would like. If any of you would be willing to speak with me and help give me some pointers, I've got a lot of planning to do before we start asking for the funds we need. As Dr. Horsley mentioned, we've got months before this project goes from being proposed to being definite. We need approval from the Tennessee Higher Education Council, which is our accrediting body, and of course the state. But we can afford to wait that long to get started. So you all will see some things on your table. You'll see there's some Post-it note pads. Some of them have my business card attached to them, and some of them have Dr. Horsley's business card attached to them. Please take one or take two, and then use our College of Nursing notepads. I also shared with you all the latest copy of the ETSU Health Annual Report that just came out. And this features what goes on across kind of the health realm within the university. Take a look, you'll see some very impressive stuff. And there's a great article about our new dean as well, which I'm sure you all will enjoy. So that's what I have. I think finally, if you all have any additional questions, we probably have, oh, it's 1 o'clock. We may not have time. Yes, sir.
Is there any opportunity for grant monies to facilitate what you want to do?
We're just beginning the process of looking into all of that. We're going to leave no stone unturned. I am talking with the university's government liaison. We're going to look into funding of any kind, private, grants, you name it. I think to do this correctly, we need to leave no stone unturned.